So we have two additional tests, special tests we're doing in the lower abdominal region. The first one is called the Murphy's sign test. It's testing for cholecystitis or an inflamed gallbladder. So what we're going to do to perform this test is we're going to use our right hand and kind of hook under the patient's right costal margin here. Angela, I'm going to ask you to take a deep breath in. I'm washing Angela's face while we're doing this. Go ahead and relax. Angela didn't seem to show any signs of pain. So that's a negative test for Murphy's sign. If the patient did have a cholecystitis, when they're taking that deep breath in, they're pressing that gallbladder right up against where my hand is. A lot of times you'll see a pain response in their face. You might even see them stop that inspiratory effort when that gallbladder presses right up against my digits. The final test that we're going to do is a hernia assessment. For this one, Angela, I'm going to ask you to raise your head and your shoulders off the table and kind of bear down. And I'm palpating in midline. We're going in the umbilical region. If Angela had any scars, surgical scars, we'd palpate there, but we're also palpating in the inguinal and femoral regions as well. Go ahead and relax. We weren't able to appreciate anything in this test that would be positive for that hernia assessment. By having Angela raise her head and shoulders up off the table and bear down, we're increasing that intra-abdominal pressure. So any cases of herniation where something is pushing through that wall would be more apparent, and we'd be able to palpate them. And the areas where we were palpating are just some common areas where you can experience herniation. If we were able to feel that sort of mass pressing through while she was bearing down, we'd suspect that it could be a herniation.